Pilonidal cyst is a kind of cyst that happens at the tissues above the tailbone. The reason behind it is the deep ingrowing of the hair. Sometimes it can be infected and causing pus discharge. We have to pay attention to the following symptoms to seek medical or surgical advice for early management for these cases. Symptoms include pain at the lower end of the spine, tenderness, swelling. Sometimes we have discharge and people can have a smelly discharge and causing bad smell. It will pay attention also. Plus we need to pay attention for fever. If we develop fever, this means pus is there and the cyst is converted to an abscess. Management for pilonidal cyst is simple if we seek early medical advice and see a surgeon as soon as we have the symptoms. If formed pus and we have some discharge, this is an urgent surgery. It's very simple. We have incision and drainage by local anesthesia in the clinic. It's 10 minutes procedure. We remove the hair, we remove the pus and leave it open till healing. This is an urgent surgery for pus drainage. Then the definitive treatment will be planned after healing established. If diagnosed from the start, with no infection, and we can go for definitive treatment as the first option. MRI is one of the diagnostic tools that help to confirm the diagnosis and rule out presence of complicated cases or branched sinuses, and will help to plan the kind of surgery. Surgical option, we prefer always the minimal invasive surgery, which is EPSIT, which is endoscopic pilonidal sinus treatment, or we can use CELAC, which is laser treatment for pilonidal sinus disease. Second option is simple surgical excision and primary closure. We remove the whole cyst and all the sinus tract. It's very beneficial, and the healing will not take time because we are doing primary closure. For some cases, in complicated cases or branched cases, we need to do wide local excision, and we'll leave it to heal with an open method till the healing is complete. For recurrent cases, we need to have another option for surgical management, which is excision and deviation of the natal cleft using a skin flap, and this is for complicated or branched cases, and it's the only solution for recurrent cases to have a new fresh tissue with new skin in the area, so it will allow healing with the new tissues. We have to bear in mind that pilonidal cyst is kind of the recurrent diseases. Its recurrence is up to 20% in cases, and we manage what is the current situation. We have to take some precautions in the future so to decrease the recurrence rate, like frequent shaving of the hair, doing laser hair removal at the area, avoid sitting on hard chairs for a long time. This will help to reduce the recurrence rate. The take-home message is to seek early medical advice if you have any of these symptoms that we mentioned regarding pilonidal sinus disease. Early treatment allows the best option for the treatment and give us the chance to use the recent technology and EPSIT or CELAC as a minimal invasive surgery. It will allow you to return normally to your normal life and normal activity soon, rather than having surgery with frequent dressing and long time follow-up.